Number one, sinusitis is very common. And the reason it's very common is that a lot of it happens after you get a flu or a cold. So you can imagine how many patients get a flu or a cold. We're about 6,000 doctors in Kenya and only about 140 ENT surgeons in Kenya. So we can't see all of those patients. So the normal type of sinusitis, the acute sinusitis, that one mostly is managed by general practitioners. When things, if they can't manage it, then they should refer to us guys. For number two, as a patient, if you're feeling that, hey, I am not getting the best care, or I'm feeling that this thing is prolonging longer than 10, 14 days and I'm not getting better, come and see an ENT surgeon. If you're feeling, hey, I don't think this diagnosis has been fine-tuned, because that's our work as consultants, to fine-tune the diagnosis so that we can put you in the right direction, then come to us guys, okay? And we'll be able to sort you out. But one of the biggest problems is that because it is so common, everybody sees sinusitis, okay? And that's why it sort of masquerades, and we really have to do some of this work, especially in terms of like educating patients and educating staff, and also educating other healthcare workers, because I know some of them are listening. There are two types of sinusitis. There's one that we call acute and another that we call chronic. Now, those are medical terms. Lay people usually feel acute means severe and chronic means life-threatening. That's not the case.
I was so
That's not the
like,
case, yeah.
Are you sure that's the only two, yeah?
So acute in medical terms just means short, and chronic means long-standing. So acute sinusitis can be caused by either viruses or bacteria. Most of them are viral sinusitis. So when you get runny nose, you get a drippy nose, you get facial pressure, you get congested nose, that could be a viral sinusitis. Now, how do we know that we need antibiotics? When, number one, it's very severe. Number two, you find that you get better, then you get worse. Or number three, it's just not being managed, it's not responding to medication. And of course, the discolored mucus, greenish, yellowish, usually that triggers to us that, this could be a bacterial sinusitis, okay? So our work is to do a physical examination, do a history, do a physical examination and find out. And most cases of acute bacterial sinusitis, you can manage it just by history and physical examination. Now, for us as ENTs, what do we offer? Because we have to offer a bit more than what a general practitioner can be able to do, a medical officer. So when a patient comes to us, what we do is that we do a more detailed examination of the nose. We do endoscopy of the nose. Okay, yes. Most people think about endoscopy only of the stomach, but you can do endoscopy of any part of your body, including the nose. So we do that in clinic. It's non-invasive. Puts a medication inside your nose to numb it up, local anesthesia, and then put a small camera inside the nose and look. And what are we looking for? We're looking to see if the drainage pathway of the sinuses are blocked. Usually that's the biggest cause. If there's any mucus or any pus inside, or if there's anything that could be causing this sinusitis. You have a deviated, used to be a boxer or used to be a football player, you get a deviated nose. You are in fights, you get a deviated nose, or even something like polyps as well, and we can talk about polyps and a chronic sinusitis. And that's our work, to take a look inside and see what could be the cause of this thing. And we get the answer right there and there. We see it on the camera and we give the patient, hey, this is your problem and this is the treatment pathway. And then many ways of treating, and we can go into that a bit later on.
Okay, so
that's acute sinusitis, yeah.
All right, yeah,
yes.
Yeah. You're going into chronic. I was even going into the aspect of surgery, but now you're explaining chronic.
Yes, yeah. So now that's acute sinusitis, and most that usually sorted out by nasal sprays, nasal decongestants, steroid sprays, and if it's bacterial, antibiotics. Okay. Now, when we say it's chronic, for us as doctors, anything longer than 12 weeks, so 3 months or longer. So chronic doesn't mean a death sentence. Chronic just means anything longer than 3 months.
In terms of the pain and
In
the
terms of
discomfort that you're feeling?
yeah, it could be on and off, on and off. It's not that you're having pain for 3 months. It could be on and off. Today is a good day, today is a bad day. You have a bit of mucus, you have a bit of facial pressure, you know. And a lot of these sinusitis problems actually cause problems with quality of life. So you find that you're in the office, everyone is asking you, hey, kwa nini uko na homa kila wakati, you know? Or you're finding that when you speak on the phone, everyone is asking, hey, your voice has changed a bit. So patient comes in, says, hey, doc, I've been having this issue for the latter part of the ear. I'm having this, all the symptoms, you know. And we put in that camera and we take a look and see. And usually at that point, we either offer advanced medication or even surgical options, you know. And advanced medication is takes a bit longer, you know. Change the certain antibiotics, change the steroid sprays, change the normal salines, that the douching, something they call nasal douching, where you actually clean inside your nose.
Is it the one that is it the nasal irrigation thing that you pour like with the kettle through your...
Yes. It sounds complicated, but when you look on the internet, look on YouTube, look on TikTok, you'll actually see that it's very straightforward. A lot of our patients do it.
But before we even move forward, how is the science with that? Because if you're pouring through this part of the nose, yes, and then it comes out. So how do you do it in a way where you... Please explain
you don't, okay.
It. Yeah.
So how the nose is set up, you have a right nose and a left nose, and they're connected at the back of the nose, okay? So they're connected at the back. And then the sinuses have very small openings into the nose. So what normal saline does, how you irrigate, is that it removes allergens, removes mucus, it removes all these dirty particles from one side and chucks it out of the other side. And what it does, it's like cleaning of the nose. It's like hydrotherapy of your nose, and it works fantastic for patients. And what patients feel is that they feel so relieved, you know. So usually what we give patients is like a 20 cc syringe with normal saline, and they just push it up their nose and it comes out. And they do that about 3 times in a day. And it helps moisten and remove all that yucky and gunk and all that stuff. And they feel a lot of relief. It's fascinating. And actually mothers do this a lot for children when they have got a stuffed nose, because little babies don't know how to blow their nose.
Yeah.
So mothers do that, but with normal saline drops. The adult nose is bigger, so you don't use drops. You use actual large volumes of saline. Yeah. And so with chronic sinusitis, that's one of the ways that we treat it. And patients feel, doc, that has worked for me. So can we continue on with that? We say, if it works for you, then move on. Do we need to escalate management? Yes, no. Do we need to do anything surgical? Yes or no. And I can let you know about surgery and all that stuff, yeah.
I see. Now, what if someone has gone into surgery for something that didn't need surgery? What happens to your sinuses?
Okay. So our work is to open. Remember, I've told you the sinuses open up into the nose with very small passages. So our work is to make those passages much bigger, so that the nose can do 2 things. Air can get into the sinus, and whatever is in the sinus can get out. Because remember, what is happening is that when you have sinusitis, there's blockage within the sinus and mucus accumulates. So our work is to get rid of all that stagnant stuff inside the sinus, get it out. So we go into theater and so there are no cuts, there are no bruises, all of it is endoscopic, minimally invasive. And get inside and open up the sinus and get rid of all that stuff, all that mucus, all that gunk. Open up all the sinuses, below the eyes, in between the eyes, behind the eyes. Open all that stuff, so you can get one big cavity. Now, that is one step of the therapy. It's multi-step, and then we now sort out the with now medication so that we can prevent recurrences. And for some patients who have what we call nasal polyps, they get this, we remove so polyps are growths inside the nose, and we remove them all. And remove them all so that you'll be able to breathe and you'll be able to smell as well.